This journal club is focused on an unusual but important diagnosis, thyroglossal duct carcinoma. When I presented this research at the ASNR, I had the misfortune of going right after Christine Glastonbury, who had presented on the exact same subject. We were fellows at the time, and we have become good friends since, probably because of this. The normal thyroglossal duct is a fetal structure that is involved with thyroid embryology. It is the leftover tract after the thyroid gland descends from the base of the tongue where it forms down to the base of the neck where it normally sits. The thyroglossal duct should completely involute, but sometimes it leaves a small tract behind and fails to completely involute. The remnants that are left behind in the thyroglossal duct may be solid, cystic, can be a sinus tract communicating up to the base of tongue, or a complete fistula if it extends out to the skin surface. But among these, the cysts are the most common, and that's why most people refer to thyroglossal duct cysts instead of thyroglossal duct remnants. I tend to be more general and talk about thyroglossal duct remnants. This is what a thyroglossal duct cyst looks like. It is a low-density structure, and its relationship to the strap muscles is critical to the diagnosis. This cyst is embedded within the strap muscles, these flat muscles that overlie the viscera in the midline of the neck. That relationship, at least for cysts that are below the level of the hyoid bone, where there are strap muscles, is critical to the diagnosis. Remember that the thyroglossal duct gets twisted into the larynx because of the way that the hyoid develops in fetal life, and so you often get intralaryngeal extension or even exclusively intralaryngeal thyroglossal duct remnants like this cyst that is extending through the thyrohyoid membrane and displacing the preepiglottic fat. Another place that you can get thyroglossal duct remnants is all the way up at the base of tongue, like this thyroglossal duct cyst. Anywhere along the normal thyroglossal duct tract is a potential location for a thyroglossal duct remnant. They don't have to be cysts. Here is tissue that looks just like the thyroid gland. It's even got a little bit of adenomatous degeneration, but look how it is embedded within the strap muscle. That is the key to the correct diagnosis here for this solid thyroglossal duct remnant. Here is a complete thyroglossal duct tract. You can see it starting at the base of tongue, extending down in front of the hyoid and wrapping around into the larynx, and then continuing down the front of the neck, embedded in these strap muscles. This is where the normal thyroid gland sits, although it's streaked out in this patient. This tract emphasizes why it's so important surgically to not just take out a cyst, but to do the entire thyroglossal tract, because you often have continuation of thyroglossal remnants anywhere along this course. So surgically, what is performed is called a cyst trunk procedure, in which the cyst is removed and then the entire tract above that, all the way to the tongue base, is removed, including the central portion of the hyoid bone. This is what happens when you don't do a cyst trunk procedure and just take the cyst out. The residual thyroglossal remnant will form a fistula to the skin surface. This is a fistulogram in which we injected the fistulous tract from the skin surface and showed that it extended all the way back up to the base of the tongue. And in fact, when we did this fluoroscopically, the patient could taste the contrast spilling onto his base of tongue. Now that we've talked about thyroglossal duct remnants, let's talk about thyroglossal duct carcinoma. This is what happened when one of these remnants degrades into a carcinoma. Thankfully, this is a rare event. Most commonly, papillary thyroid carcinoma is the result, although other cancers can arise, even squamous cell carcinoma and other forms of thyroid cancer. The clinical scenario in which you should think about thyroglossal duct carcinoma is an adult patient with a growing mass in the midline neck. The demographics of thyroglossal duct carcinoma are more similar to the demographics of thyroid cancer than it is to thyroglossal duct cysts. Thyroglossal duct cysts are most commonly a pediatric diagnosis, and in fact a very common pediatric diagnosis. But when an adult presents with a thyroglossal duct remnant, that's when you should consider maybe this is an undiscovered remnant that has degraded into carcinoma. The radiologic findings that we associate with thyroglossal duct carcinoma are calcifications and mural nodules. These calcifications are of course associated with papillary thyroid carcinoma, just as they would be in the gland itself, and a mural nodule along the margin of the cyst is a very concerning finding. Now you have to be a little bit careful because calcifications, septations, and mural nodules are also seen with repeat infection of a benign thyroglossal duct cyst. So this isn't perfect, but if you have this clinical scenario and this radiologic manifestation, then you should be strongly considering thyroglossal duct carcinoma. Here's what it looks like. Here's a thyroglossal duct cyst, and you can see along the posterior margin of the cyst there is a calcified, partially calcified, enhancing mass. This is what we mean by a mural nodule. It's a nodule of enhancing tissue embedded in the wall of the cyst. Here's the same patient in the axial. You can see the cyst walls, and now you can more clearly see the calcifications associated with the enhancing portion of the disease. Here's a more subtle example. You can see a thyroglossal duct cyst. Notice the relationship to the strap muscle. It's embedded in the strap muscle. And here, subtly along the medial aspect, you can see those fine speckled calcifications that we associate with papillary thyroid carcinoma. But there's another clue on this image, and here it is. Here's another cystic mass in the expected location of the lymph node. That's a metastasis of this carcinoma. This is that same picture, and this is an image that better shows the node in question or one of its friends, and you can see the suggestive calcifications in a cystic, partially cystic lymph node. Here's another example, a large cyst anteriorly, and you can see more posteriorly this enhancing nodule. Now this one's a little more confusing because it's right along the hyoid bone here, but you need to recognize that this is enhancing tissue, a mural nodule associated with the cyst. So we should be thinking about thyroglossal duct carcinoma when we have an adult patient with an enlarging midline neck mass, when that mass looks like a thyroglossal duct remnant, except there are calcifications and or mural nodules associated with the thyroglossal duct cyst.